everyone, my name is Rainjan Cyrey Argota from BSN 11E. And today I'm going to perform the assessing the abdomen. So pre-introductory phase. Review the client's previous medical record and doctor's order if it is available. So the rationale of that is, it is very important to review the client's record for you to know the health status of your client. So the next thing that I'm going to do is I'm going to determine the scope of the assessment needed and prepare the necessary equipment that are needed for the assessment. So I already determined what is the assessment that I'm going to do today. So the assessment I'm going to do is I'm going to assess the abdomen of my patient. So these are the equipments that are needed for the assessment. The documentary sheet in where I could put all the documentation of my patient. The next is the stethoscope, the pen light for the inspection, and a medicine tray, and also the measurement tool. And now I'm going to perform the hand hygiene procedure. So the rationale of this is to prevent the spread of all microorganisms and to ensure that there are no contamination happen. So introductory phase. Greet the client politely, introduce yourself, verify the client's identity, and ask how the client, how he or she would like to be called. And sir, can you please speak here, sir? Hi sir, my name is Rainjan Cyrey Argota, and today I'm going to be your student nurse. So I have some question for you, a basic question for you. So may I know for your name?
I'm Shigeru and Mizuno. I'm 14 years old.
You're 14 years old. Sir, do you have any medical history?
Wala.
No? Okay, alright. So the next thing that I'm going to do is I'm going to explain the procedure to the client and how he or she can participate during the assessment, provide the client's opportunity to ask, clarify, and ask any constraints. So sir, the thing that I'm going to do today with you is I'm going to assess your abdomen. So do you have any questions before we can proceed to the procedure?
Wala.
No, you don't have. And sir, are you okay if I'm going to check your abdomen part?
No.
Okay. Alright. So ensuring the client comfort, privacy, confidentiality, assessment setting was assured to be safe, and also it is assured that it is free from distractions. So sir, are you comfortable with the temperature in the room?
Okay lang.
Are you okay with closing the door?
Okay lang.
Closing the window?
Okay lang.
Okay, so the rationale of that, it is very important to ensure your client's comfortability, privacy, and confidentiality. So it is very important. Please remember that comfortability and confidentiality of your client is the most important thing in a hospital setting. Working phase. Surveying the abdomen. Position the client in a supine position. Hi sir, can you please lay down? Sir, are you now comfortable with your position right now?
Opo.
Okay, thank you sir. Rationale. Ensure the client comfortability, and also you can execute the assessment properly. The next step that I'm going to do is I'm going to cover the upper and the lower part of the parts of the body of the client with a bed sheet and leaving the abdomen exposed. Sir, may I ask you to, it would be okay for you to remove your t-shirt? Wait sir. Your lower part. Is
Hindi
that
na
okay
lang
with you?
kayo po, Hindi ko comfortable.
Okay sir, I respect your decision. Okay sir. Sir, you can now remove your shirt. Please lay down, sir. Sir, can you please move a little bit? Okay, thank you. Are you okay with your position, sir?
Okay lang.
Sir, I will leave your abdomen exposed, sir, so I can do the assessment properly. are you na comfortable with it?
Opo.
Rationale, covering the other parts of the body of your client is to ensure the client's privacy. The next step that I'm going to do is I'm going to observe the abdominal skin. Look for any vascularities or spider veins or veins. Note for any stray or stretch marks. Assess the scars, lesion, and rashes. Note for history for scars and document its location by quadrant reference line. So now I'm going to inspect for any scars in your body, sir. I hope you would participate. Okay. So far, there are no stray or stretch marks, and I didn't see any abnormalities with your skin. So it's normal. So the rationale for this is to check if there are any presence of edema, lesion, vascular lesion, or any discoloration in the abdomen of my client. The next thing that I'm going to do is I'm going to inspect the obliques for its to the color, the contour, and the location. So the rationale of this is to check if there are any discoloration regarding the skin of the patient. So now I'm going to check your skin. So you can breathe. Okay. As what I've inspected, there are no discoloration regarding with your skin. It is normal, and I didn't see any lesion with it. So the rationale of that is inspecting the skin of your client is to know if there are discoloration. So examining the abdomen. When the client lies flat in a supine position in a bed, so I will sit beside the client, look across the abdomen, and level slightly higher than the client's abdomen. So now I'm going to sit here at the side of my client, so I could know if there are abnormalities like acids in the abdomen of my client. And as what I am seeing, the abdomen of my client is flat and it is equal, and there are no any abnormalities as what I'm saying. So the rationale for that is to determine if there are abnormalities like acidity in the abdomen of my client. The next thing that I'm going to do is I'm going to inspect the abdominal girth, the area between the lower ribs, pubic bone, and note for any abdominal enlargement. So I will check here, the part here of my client, the pubic bone. No, sir. As what I am inspecting, I didn't see any enlargement in the bone or in the part between the lower ribs or the pubic bone of my client. So the rationale of that is to determine abdominal distension. So the next thing that I'm going to do is I'm going to measure the abdominal girth using measuring tape. So this is my measuring tape. Now I'm going to measure the abdominal of my client. Make sure that the client emptied his or his bladder. So my client is already emptied his bladder. So the rationale for this is to have an accurate measurement. So now I'm going to measure your here in the pubic bone and here in the lower ribs. Is that okay?
Okay lang.
Okay, thank you. Okay, I will now document the size of your pubic bone and the size of your lower rib. The next step that I'm going the client in a supine standing position. Please use a disposable tape and place it behind of the client. Measure it from umbilicus. So the rationale for that is to determine the abdominal distension. So the next thing that I'm going to do is I'm going to record the distance, centimeter or inches, of the abdominal or of the abdominal part of my client. So I already did it earlier. So the rationale for that is documenting it is very important and also to monitor. Next is take all the future measurement from same location. The rationale if there are increase or decrease size with the abdominal size of your patient. So the next step that I'm going to do is mark abdomen with pen. Ask the client to not wash the mark until it's not the assessment is not done. So I have my marker here and this is my measurement tape. Poster I would mark it. Sir, please don't wash it, sir, so it will not wash out, okay? So the rationale for this is marking can help you to identify the measuring place in where you would put the marks or in where you could do the assessment. So next is check for symmetry. Ask the client to raise his or her head. So sir, can you please look upward so I could check here this side. So far, all I can see is a little bit redness, and don't you worry, sir. I will put it in my documentation so your physician would know it. Okay, sir. Rationale is to check the distinction. So inspect the abdominal movement when the client breathes. Observe the peristaltic waves of it. So sir, can you please breathe normally so I could check if the wave in your abdominal is normal? Can you do that for me? Okay. So now sir, can you please breathe? Normal breathe. Breathe, sir. Okay. So far I didn't see any waves in your abdominal part. It is okay. I think your breathing is okay and there are no any problems with it. So the rationale for that is to determine the auscultation. Auscultate the bowel signs. Use the diaphragm of the stethoscope and make it that it's warm before placing on the abdomen. So this is the stethoscope. This is the diaphragm of the stethoscope. Please make sure that before you put it into the abdomen of the client, please make sure it is warm so that your client would be comfortable while I am doing the assessment. Rationale for this is to promote the comfort of the client. Next is apply gentle pressure and let the stethoscope rest in abdomen and fender. The rationale for this is to prevent increasing the pain. So while assessing or while auscultating, you should ask your client if he or she feels pain while you're pressuring the stethoscope in the abdomen of your client. Sir, do you feel any pain when I press over the stethoscope?
Wala, okay lang. Wala lang.
Okay. Breathe normally, sir. So far, while listening to your abdomen, I didn't hear any bulging or murmur in your abdomen. So it means that I didn't notice any abnormalities within your abdomen. So the next thing that I'm going to do is auscultate and start from the right quadrant here and clockwise further for the right upper quadrant, right lower quadrant, left lower quadrant, and left upper quadrant. So I'm gonna start here at the right lower quadrant, which is here. And what I've said, listen for it for 5 minutes, or minimum for it is 1 minute. Let's assume that I've listened it for 1 minute, and then I'm going to proceed to the left lower quadrant. And then clockwise to the upper quadrant. I mean the right upper quadrant. And lastly, the left upper quadrant. So the rationale for this is for you to know the vowel sounds and the cause of muscular contractions in the abdomen of your patient. So after that, I already get the done with the abdomen auscultation. Let's proceed for the auscultation for the vascular sound. So the use of the ball of the stethoscope. So this is the ball of the stethoscope. It is used to listen the bruits of in the abdomen of your client. So I'm going to use the bell here. Do you feel any pain when I press it? Here.
Wala.
So far as I've listened it, I didn't hear any bruits in your abdomen area. So probably the result with that for me is normal. So the rationale for that is the bell in the stethoscope is used to detect any low frequency in the abdomen of my patient. So the next step that I'm going to do is that I'm going to auscultate for the venous hum. Use the bell of the stethoscope, which is this again. Listen for venous hum in epigastric umbilical area. So I've already done it earlier. That's it. And the rationale for that is to determine if my patient has a portal hypertension, and also auscultate for friction drop. So while using the diaphragm of the stethoscope, this one is auscultate and listen for friction, rub over the liver and spleen. Or the rationale for this is you can indicate the inflammation in the abdomen of your patient. So now I'm going to listen again in using the diaphragm for I could detect if there are any abnormalities regarding with the liver and the spleen of my patient. So the liver is indicated in the right lower quadrant of my patient. So now I'm going to put the diaphragm of the stethoscope here. Sir, are you okay?
Opo.
Whenever I press it, don't you feel any pain or any tender? For me, I didn't feel any tenderness, but for you, do you feel any pain?
Ano?
So far as I listen for the liver and the spleen, there are no any abnormalities regarding with it. So the next thing that I'm going to do is I'm going to proceed to the percussion. Since you follow the IAPP, which is the inspection, auscultation, percussion, and palpation. So we're gonna follow what's in the PR. So first thing that I'm going to do is I'm going to percuss all the quadrants for tone, slightly systematically, either clockwise or up or down, a ratio of it. So the rationale is to determine the size, location, and the abdominal organs. So let me put the stethoscope first in the medical table, and now I'm going to percuss the abdominal of my patient. So sir, can you please put your hands over here? Tell me if do you feel any pain whenever I percuss your abdominal? Is that okay with you?
Okay lang.
Okay. Now, here in the right upper quadrant of it, do you feel any pain
Wala.
whenever I do this?
Wala.
Here, in the side. In the left upper quadrant.
Wala po.
Okay. Since, as I asked my patient, whenever he feels any pain, whenever I do the percussion techniques, my patient always says that he didn't feel any pain. So the meaning of that is that my patient didn't have any abnormalities regarding with the lower, the right upper and lower quadrant of my patient, and the left lower upper quadrant of my patient. The second thing that I'm going to do is I'm going to percuss the span, the height of the lever, so I can begin so I would begin in the right lower quadrant, then upwards quadrant. So the rationale for that is to identify the possible hepatomegaly, or what we call HEPA. So I'm going to percuss from upper to lower. Do you feel any pain whenever I do it?
Wala.
In this part, I do hear some dullness whenever I do this. Are you sure you didn't
Wala.
feel any pain? Okay. So as my patient stated that he didn't feel any pain whenever I do the percussion. So let's proceed to note the change for tympani. To dullness, then mark the area of the dullness noted. So I asked my client if he feels any pain, but my client stated that he didn't feel any pain. So further, I will not note. I will just note in there that my client didn't feel any pain. So the rationale for that is to identify the liver border and dullness of the abdomen of my client. After percussing the span or height of the liver, we will now assess the descent. First is I'm going to locate the liver border of dullness. So since the liver is located in our right lower area, so I'm going to percuss the liver so I would know it. As what I've seen in my client reaction, he didn't feel any pain, and also I didn't feel any dullness with the liver part of my client. So the rationale for that is to determine the border or the dullness in the liver area. So now I'm going to observe for the descent lower border while the client will hold his or her breath and then percuss it. So sir, I'm going to ask for you to please breathe for me. Hold your breath for me. Can you please exhale? Inhale. Inhale. Exhale. Exhale. Inhale. Exhale. Can you please inhale, sir, for a minute? I mean for a second. You can now exhale, sir. So the rationale for that is to identify if the liver is enlarged. So since my client is normally breathing whenever I ask him to inhale and exhale, he always he do it well, and I cannot see any abnormalities regarding with this breathing. So the next step that I'm going to do is that I will now percuss the upper border, and I will locate first the upper right chest and percuss the downward. So sir, can you please put your hands on this side, so I could assess your chest. So I'm going to start here upward in the chest of my client. So the rationale for this is to identify the upper border of the liver dullness. So now I'm going to proceed to percuss the upper border. First is I'm going to locate for the upper chest and percuss the downward, and then mark the point from the upper chest until the dullness is noted. So now I'm going to percuss in the chest of my client, sir. I will just move this towel. So what I have just percussed is that I feel slightly dullness in the center of the chest of my client and here at the lower center of the abdomen part of my client. So the next thing that I'm going to do is I'm going to measure the distance between the two marks that I've done, which is the upper center chest and the lower center chest. And I will repeat the percussion to identify or the mid-sternal line of it. So now I will now get my measurement tape. So the rationale for that is to determine the liver size of the abdomen, the liver size of my client. So the next thing that I'm going to do is I'm going to percuss the upper border, and I will now percuss the spleen. Begin the posterior to the left, mid-axillary downward, and note for change and resonance to dullness. So, sir, I will now percuss here in your axillary, here and here also. So can you please widen your arm so I could percuss it. So let me cover your chest again. Another side. Do you feel any pain whenever I do this?
Wala.
So the rationale for this is to look for any splenic enlargement in the abdomen part or in the square part of the abdomen of my client. So now I'm going to perform the method of percussion, and I'm going to ask my client to please take a deep breath and then percuss the last left space at the anterior axillary line. So this is the anterior axillary line, which is here in the axillary line of my client. So I'm going to percuss it. Sir, do you feel any pain?
Wala.
No? Yes, sir, ha? No, sir. The other side. Do you feel any pain whenever I do that?
Wala.
Okay. For the rationale of that is so I could determine the splenic enlargement in the axillary side of my client. So the next step that I'm going to do is I'm going to percuss the blunt on the liver, and I'm going to ask my client to sit with his to sit, and then I'm going to face his back. So, sir, I would like to ask if you allow me to ask you to please sit down so I could check your back. Is that okay with you?
Okay lang po.
Okay, sir. Please be careful, sir. Okay. Straight your back. And then now I'm going to percuss it, starting from the lower part into the upper part of it. Do you feel any pain whenever I do it?
Wala.
Here in the right side,
Wala po.
the upper side,
Wala po.
in the left upper side.
Wala.
Okay. So as what the reaction of my client, he didn't feel any pain whenever I do the percussion thing. So the rationale for that is to evaluate the size of the asthenic enlargement of my client. So the next thing that I'm going to do is to place your left first again, the lower right anterior ribcage, which is here in the back of my client, the right ribcage of it, and use the ulnar side of your right hand, which is here, strike the left, and also note for tenderness whenever you percuss it. So I'm gonna use the ulnar side of my my hand and put it to the rib cage in the anterior side of my client. Sir, whenever I percuss it, do you feel anything?
Wala.
Here, sir.
Wala.
The rationale for that is to evaluate the size of it. That's it. And then next is I'm going to percuss the blunt in the back of my client so that I could check the kidneys. And now I'm going to ask my client to sit with her back facing me again, and then I'm going to place myself until the hand and contravertebral angles. So now, sir, please straighten your back. And now I'm going to percuss it. Sir, do you feel any pain whenever I slightly move my hand in your back?
Wala.
Any pain, like slight pain or hard pain? There is none?
Wala. Normal.
Okay, thank you for this one. So next thing that I'm going to do is I'm going to evaluate the size of the kidney. So I am now asking my client to please sir, can you please side your body here, fronting here, sir, so I could check your kidney side. So please be careful, sir, whenever you turn. Since I am not in a hospital setting, so I am finding a way so I could check the kidney of my client. So this side, I'm going to percuss it like this. Sir, do you feel any pain whenever I do it?
Wala.
No? Okay, sir, thank you. Here, sir, when I percuss in this lower part, do you feel any pain or any tingling thing?
Wala.
So the rationale for that is to determine any abnormalities regarding with the kidney of my client. So since my client stated that he didn't feel any pain while I'm percussing it, so it means there are no abnormalities with it. So the next thing that I'm going to do is I'm going to assist my client to turn into the side then and percuss the abdomen with the bed upward and level of dullness of tympani. So sir, can you please get back in the old position in where you were earlier? Okay, now you can now lay against it. So now I'm going to check the level of dullness in the tympani area. So here. So when you percuss it, please make sure that you slightly press it and don't over press it because you may hurt your client. Sir, do you feel any do you feel any pain whenever I press it like this?
Wala.
Okay. Now I'm going to bring see here on the side. In here, sir.
Wala.
Okay. Thank you for the response, sir. So the rationale for that is to determine any abnormalities. And for the last step, perform the percussion with a fluid wave test by asking the client to assist you. Please make sure that you ask your client to assist you. For his or her ulnar side and hand and lateral side of forearm and midline for the abdomen. Then place the palmar surface, which is this palmar surface, in a finger's hand to the one side of the client's abdomen. So sir, may I ask you to please assist me when I'm doing the assessment? Can you please put your hands in the ulnar side here, sir, so I could percuss it properly. Do you feel any pain whenever I percuss it like this?
Wala.
So, okay. Here, sir, can you please do like this? Do you feel pain whenever you do that?
Wala.
Okay, sir. So, as the client stated that he didn't feel any pain whenever, use your other hand to talk, which is I did to my client when he helps me while doing the percussion. And then the rationale for that is to identify possible ascites. So after doing the percussion, please do the note the documentation or the information that you have gained while doing the percussion. Yeah, stop job. Palpation. So after doing the percussion, we will follow again the IAPP. So the inspection, auscultation, percussion, and finally the palpation. So now I'm going to position my client in a supine position and cover the upper and the lower parts of his body and leaving the abdomen exposed. So since I've already done it, I'm covering the lower part and the upper part of my client. So the rationale for that is to ensure or avoid unnecessary exposure of the body of my client. So the next thing that I'm going to do is that I'm going to palpate non-tender abdominal quadrants. First, using my fingertips, which is this. These are my fingertips. The quadrant 1 centimeter dipping motion using my fingertips. Using your fingertips, this is my fingertips. Compress the quadrant 1 centimeter in dip motion. So now I'm going to use my fingertips to palpate the abdomen part of my client. Sir, do you feel any pain whenever I do the palpation? Sir, are you tingling with it when I do it? It's part of the assessment. So since my client didn't feel any pain whenever I do the palpation, it's normal to that he feels tingling sensation. So the rationale for this is to determine any abnormalities in the abdomen part of my client. So now I'm going to lift my fingers, gently proceed to the next quadrant. Lift your fingers gently or like this and proceed to the next quadrant of delineate organs. Begin palpating deeply all the quadrant areas of with the 5 to 6 centimeters using the palmar surface of your hand, which is this. Note for any deeper structures or resistance in the abdomen part of your client. So now I'm going to use the palmar surface of my hand. Sir, do you feel any pain whenever I push it?
Wala.
Here.
Wala.
So I am starting from the upper quadrant of my client. So lower, starting in the lower part.
Wala.
Okay. In the umbilical part.
Wala.
Here on the side, left lower part.
Wala.
So the rationale for this is to determine any abnormalities. So the next thing that I'm going to do if the structures are deeper or resistant, please hold or perform a manual palpation. The rationale for that is so you could determine any enlargements. So since my patient didn't feel any pain whenever I push my ulnar hand palm in the abdomen part of my client. So now I'm going to proceed to palpate the muscles using your fingertips. Again, this is my fingertips, and compress all the quadrants in 1 centimeter. Dipping motions. Note for any muscles and its location and shape and mobility. So now I'm going to use the fingertips of my hands. So I'm again starting in the upper quadrant of my client. Sir, do you feel pain?
Wala.
Or do you feel tingleness?
Ah.
You're tickle with it. That's okay, sir. That's fine. You can laugh whenever you feel it funny. Here, sir.
Wala.
In this part.
Wala.
Okay. So the rationale for that is to determine any enlargement in the abdomen part of my client. The next thing that I'm going to do is I'm going to palpate the umbilicus. Note for swelling, muscles, and bulges. So this is the umbilicus part. So now I'm going to use my hands to palpate it. So I could know the masses and if there are any bulges. in the abdomen or swelling in the abdomen part of my client. Sir, do you feel any pain or any senses whenever I do this?
Wala.
No. Okay, the rationale for that is to identify the possible umbilical hernia or what are those abnormalities that may possibly be in the umbilical area of my client. So now I'm going to palpate the aorta area of my client, which is here in the chest area. So first I'm going to use my thumb. This is my thumb. And the first finger, which is this, for the of my hands. And then I'm going to palpate it deeply and assess for pulsations. So this is what I'm going to use. So the aorta location is in here. So while using my thumb and the first fingertips of my hand, this is I'm going to use to palpate the aorta area of my client. Sir, do you feel any tension or any pain whenever I do it?
Wala.
Do you feel any sensation?
Wala.
Okay. So the rationale for that is to determine possible abnormal expansion in the aorta part. So the next thing that I'm going to do is I'm going to palpate the aorta, liver, and then I'm going to stand at the right side of the client. Next thing that I'm going to do is I'm going to place my left hand under the client's back and with the 11 and 12 ribs. And I'm using the right hand parallel while my fingertips are pointing towards the client's head. So now I'm going to ask my client, sir, can you please sit down? Okay, and now can you please put your body in this position? So now I'm going to check for the liver of my client. So I'm going to use my hands to check in this part. Sir, do you feel pain whenever I do this?
Wala.
Here, sir.
Wala.
So I'm going to place my hands in the 11 and 12 part of the ribs of my client. Okay. Do you feel any pain whenever I palpate your lower ribs in the back?
Wala.
Okay. So the rationale for that is to determine tenderness and tenderness of muscles. So the next thing that I'm going to do is I'm going to compress upward and inward with the finger while the client is inhaling. Then I'm going to note for the consistency and tenderness whenever I feel something whenever I compress upward and inward of the client. So, sir. So, do you feel any pain?
Wala.
So, as what I have observed, I didn't feel any tenderness and consistency in the back of my client while I am palpating it. So, the rationale for that is the liver will move downwards due to the diaphragm movement whenever he feels pain. If he feels pain and if the palpation is in this condition of consistency and tenderness. So the next thing that I'm going to do is I'm going to palpate the hooking and I'm going to stand right of the client. So since I am not, I cannot provide a hospital bed, so I cannot go in the right side of my client. So I find a way so I could palpate the right side of my client. So then I'm going to hook with a curl hands, fingers rather, with both hands and then the edge, right costal margin of it. So now I'm going to curl my fingertips and then I'm going to put it here at the each side of my client. Sir, do you feel any pain whenever I palpate each sides of your abdomen?
Wala. Normal lang.
Okay. Even a slightly pain, you don't feel it. Okay. The rationale for this is this technique is helps to identify if the liver has an enlargement. So the next thing that I'm going to do is I'm going to ask my client to take deep breath and gently, firmly pull inward and upward with my fingers. So now I'm going to note for the tenderness and consistency. So, sir, can you please put your do the old position earlier? So now I could but now check the your breath when you're breathing. Sir, can you breathe normally? Breathe normally, sir. Inhale, exhale. Deep breathe. Super deep. Like your ribs would be visible when you breathe. Okay. Do you feel any pain?
Wala.
So as I am doing the palpation, I didn't feel any tenderness and dullness when I do the palpation. So the rationale for that is the liver will move due to diaphragm movement. So as what I have I didn't feel any abnormality. Now I'm going to test for the cholecystitis. Place your fingertips in the liver board of the client. So here is the liver board of my client. Use your fingertips. Do you feel pain, sir?
Wala.
Okay. For the rationale of it is to determine the gallbladder and inflammation of the kidney of your client. So the next thing that I'm going to do is I'm going to palpate and choose I didn't choose the method 2 in where I could ask my client to turn into the right side. So sir, can you please turn into the right side, like that, sir? Can you please forward here? Okay, sir. Thank you, sir. And place your hand there. Sir, can you please breathe normally, sir, whenever I palpate it? Sir, do you feel any pain or tenderness?
Wala.
Okay, sir, thank you. The rationale for that is to determine if there are any kidney enlargement or liver enlargement. So below the costal margin, document the size and the centimeters of the, also note the consistency and tenderness of the costal margin of your client. So I'm going to use my measurement tool so I could measure the costal margin of my client. So when you do the measurement, please take note all the measurements that you have done. So the rationale for that is to determine the splenic enlargement of your client. So the next thing that I'm going to do is I will palpate the kidney first, as I'm going to place myself to the left posterior side and to the right posterior side of the client. So since I'm not in the hospital setting, so let's just pretend that we're in that. So now I'm going to palpate the right quadrant of my client and the left quadrant. So do you feel any pain?
Wala.
So the rationale for this is to palpating the enlargement of kidney. So now the next thing that I'm going to do is that I will ask my client to hold his or her breathe while I'm palpating his abdomen. So sir, can you please breathe normally, sir, whenever I palpate your abdomen and here in the right side and the left side. Is that okay with you, sir?
Okay.
Okay. So can you please breathe now, sir? Breathe normally. So as I palpated, I didn't feel any tenderness and any sensation whenever I palpate my clients here in the kidney area. So the rationale for that is so that so your client obviously serves his healthy body. Okay, the next thing that I'm going to do is I will not palpate the kidneys. First, I'm going to palpate the symphysis pubis and move the upward and outward area. So here, I'll palpate here. Sir, do you feel pain?
Wala.
So the rationale for this is to make sure that the kidney is properly.
No.
So the next thing that I'm going to do is I'm going to palpate the hypersensitivity test, which I'm going to use my thumb and the first fingertip of my hand. So now I'm going to. Sir, do you feel pain whenever I stuck it?
Wala.
When I released it?
Wala po.
So the rationale for this is that to determine the reaction of the abdomen whenever I do that palpation. So the next thing that I'm going to do is I'm going to place my right hand below the costal margin and in an exaggerated, so I could see the exaggerated reaction of the skin. So I'm going to place my right hand in the costal margin. So do you feel pain when I pushed it? When I released it?
No.
Okay. That's what my patient stated. He didn't feel any pain whenever I pushed it and released it. So the next thing that I'm going, so the rationale for that is to determine any pain reaction when doing the palpation.
Fire.
The next step that I'm going to do is I'm going to assess the psoas sign. First, I'm going to ask my client to lie in a left side. So, sir, can you lie in this left side like this? Sir, okay, like that. And then, I'm going to get the cover. Okay. Can you just hold it? Do it like 4 or 5 times. 3, 4, and so the rationale for that is to if the patient is positive with psoas sign, it may indicate as appendicitis.
Play.
The next step that I'm going to do is I'm going to do the obturator sign. Hold this and support the right knee of your client. So now I'm going to do is I'm going to do the obturator sign, which I will hold the right knee of my client and ankle of the client. So remove. Sir, can you please straighten your left leg and then let's do it for like 5 times. 1, 2. Do you feel any like weird feeling whenever I do it?
Wala.
Okay. So the rationale of it is to determine possible pelvic abscess.
Go.
So flex the knee and the hip of your patient and rotate the leg internally and externally. So now let's remove again the cover and let's start with the left. Do you feel your bone moving whenever I do it? So, repeat. Like do it for like four circulation each leg. So, 1. So after doing it, note for any observation, and then the rationale for that is to determine any possible pelvic abscess. So the next thing that I'm going to do is I'm going to test the appendicitis. First is I'm going to assess the rebound tenderness, palpate at 90 degrees into the abdomen, then release the pressure next to the client's expression or next to the client palpation. So here is the appendix side of my patient, and I'm going to palpate it using my palmar surface with the 90 degrees pressure. So do you feel any pain whenever I palpate your appendix location?
Wala.
Okay. So what I've observed is that I didn't feel any tenderness and dullness in the appendix site or location of my patient. So the rationale for that is to determine any possible appendicitis abnormalities. So the next thing to do is I'm going to ask my client while I'm palpating the appendicitis area. I'm going to ask the client if it is painful whenever I pressed it or whenever I released it. So, sir, the next thing that I'm going to do is I'm still going to palpate the appendicitis area. So when I press it, do you feel pain?
Wala.
When I released it, do you feel pain? Like this, sir. Do you feel pain?
Wala.
Okay. As what the patient stated, he didn't feel any pain whenever I pressed the appendicitis area. So the rationale for that is that the patient appendicitis area is to check the patient appendicitis area if there are any abnormalities detected. So the next thing that I'm going to do is I'm going to ask the client where the abdomen pain occurred, and the rationale for that is to document the obtained information. So, sir, we are finally done with the assessment. So I would like to ask a last question. You do feel pain in any part of your abdomen area?
Wala na.
Even here in the side?
Wala.
Here side?
Wala po.
Not all over?
Wala
No.
talaga.
Okay, so my patient stated that he didn't feel any pain with his abdomen area. Now, since I am done doing the assessment regarding with the abdomen, now I am now going to help my patient to take on his or her clothes. So, sir, I am now done doing the assessment regarding the abdomen. You may now take on your clothes and let me help you, sir. Okay, sir. You may now take on your clothes.
Okay na.
Okay, sir. So, let me just put this here. So now I'm going to summarize all the informations that I have gained from earlier assessments. So now, sir, since we're now done with the assessment, I will now state all the summarization regarding with the abdomen assessment. So we use the IAPP, which is the inspection, auscultation, percussion, and palpation. And I will just inform you what are the results and let your physician inform you what steps are we going to do after this assessment. Okay, is that okay with you, sir?
Oo.
Okay. So, sir, thank you very much for participating with this assessment, and I really appreciate it. And I hope you have a good day, and God bless you, sir. Again, my name is Rainjan Cyrey Argota. I'm your student nurse for today, and have a great day, sir. And now I am done doing the assessment regarding with the abdomen, and I hope that it makes it clear whenever I do the assessment. Again, my name is Rainjan Cyrey Argota from BSN 11E. Have a great day, everyone.